Yaws is an infectious disease that has plagued humanity for centuries. This chronic bacterial infection primarily affects the skin, bones, and cartilage. Although it can affect people of all ages, yaws disproportionately impacts children in tropical regions with poor sanitation. Caused by the bacterium pertenu, a close relative of the syphilis-causing bacterium, yaws is spread through direct contact with infectious lesions. The disease often manifests as painless sores, typically on the legs, arms, and face. Despite its treatable nature, yaws can lead to long-term disfigurement and disability if left untreated. This underscores the critical need for awareness, early diagnosis, and prompt treatment. The fight against yaws is not just about treating a disease, it's about improving the lives of vulnerable populations. Eradicating yaws means breaking the cycle of poverty and stigma associated with this debilitating disease. It's about empowering communities with the knowledge and resources to protect themselves and future generations. Yaws progresses through distinct stages, each characterized by specific symptoms. Understanding these stages is crucial for timely diagnosis and effective management. The initial stage, primary yaws, appears within 3 to 4 weeks after infection. It presents as a single painless sore called a mother yaw. Secondary yaws develops later, marked by widespread skin lesions. These lesions can vary in appearance and may ooze fluid. Bone pain and joint swelling can also occur. Without treatment, yaws can progress to the tertiary stage, causing destructive lesions. These lesions can affect the bones, causing deformities and disabilities. Fortunately, tertiary yaws is less common today due to advancements in treatment. Early diagnosis and treatment are vital to prevent the progression of yaws. Diagnosing yaws involves clinical presentation, medical history, and lab testing. A thorough physical examination is the first step. Providers examine the patient's skin for yaws lesions. Laboratory tests confirm the diagnosis. Blood tests detect antibodies specific to yaws. Microscopy of lesion fluid provides a definitive diagnosis. Rapid tests expedite treatment in resource-limited settings. Accurate diagnosis is key to effective yaws management. The good news is that yaws is easily treatable with antibiotics, primarily penicillin. Penicillin, administered as a single intramuscular injection, is highly effective in curing yaws. This simple treatment can prevent the progression of the disease. For those allergic to penicillin, alternatives like azithromycin may be prescribed. Compliance is crucial for successful outcomes. Patients must complete the full course of antibiotics as directed. Treating close contacts helps prevent the spread of bacteria. Community-based treatment programs are effective in controlling yaws outbreaks. Section 5. Preventing yaws, a shared responsibility. Preventing yaws requires a multifaceted approach involving individual responsibility, community engagement, and public health interventions. Educating communities about yaws, its transmission, and prevention is paramount. Raising awareness about the importance of good personal hygiene, such as regular hand washing with soap and water, is crucial. Avoiding direct contact with yaws lesions is essential to prevent transmission. Children should be discouraged from touching or scratching sores on themselves or others. Clothing, towels, and bedding should not be shared among individuals with and without yaws. Improving sanitation and access to clean water are vital for reducing the risk of yaws transmission. Proper waste disposal and safe water sources can significantly impact the prevalence of the disease in endemic communities. Preventing yaws is a shared responsibility that requires collaboration among individuals, communities, and healthcare providers. By promoting healthy behaviors, improving sanitation, and raising awareness, we can create environments where yaws cannot thrive. Section 6. Controlling yaws, a collaborative effort. Controlling yaws outbreaks and working towards its eradication requires a coordinated and collaborative effort involving national governments, international organizations, and local communities. Surveillance systems are crucial for monitoring yaws prevalence, identifying outbreaks, and evaluating the effectiveness of control programs. Community engagement is paramount for successful yaws control. Engaging with community leaders, healthcare workers, and traditional healers can foster trust and encourage participation in control efforts. Educating communities about the importance of early diagnosis and treatment is essential. Mass treatment campaigns where entire communities are treated with antibiotics have proven highly effective in interrupting yaws transmission. These campaigns target both individuals with active yaws and their close contacts, reducing the reservoir of infection within the community. Controlling yaws requires a sustained and coordinated effort. By investing in surveillance, strengthening healthcare systems, and fostering community engagement, we can interrupt transmission and work towards a future where yaws is a disease of the past. Section 7. The importance of early intervention. Early diagnosis and treatment are paramount in managing yaws effectively. Yaws is curable with a single dose of penicillin. This simple intervention prevents long-term consequences. Early intervention reduces the spread within communities. Prompt treatment breaks the chain of transmission. This proactive approach improves overall health and well-being. Section 8. Yaws Beyond Medicine, Exploring Other Contexts. While yaws primarily refers to the infectious disease, the term has also permeated other aspects of language and culture. In informal speech, yaws is sometimes used as slang to describe something unpleasant or undesirable. For instance, one might say, "That movie was a real load of yaws." Regionally, yaws might have different connotations or even alternative meanings. In some Caribbean dialects, it can refer to a type of sweet potato. Understanding these diverse uses of the word adds another layer to its complexity and highlights its cultural significance. Popular culture hasn't entirely escaped the influence of yaws. While not a common theme, the disease has occasionally appeared in literature and historical accounts, often serving as a reminder of the health challenges faced by past generations. Exploring these alternative contexts reminds us that diseases like yaws are not just medical entities. They are intertwined with human experience, shaping language, culture, and our understanding of the world around us. Section 9. The Future of Yaws Eradication. The World Health Organization has identified yaws as a potential candidate for eradication. This ambitious goal is achievable with sustained commitment, adequate resources, and collaborative efforts from global partners. The success of previous eradication campaigns, such as the eradication of smallpox, provides valuable lessons and inspiration. The WHO's current strategy for yaws eradication focuses on mass drug administration with azithromycin, surveillance, and community engagement. By targeting entire communities with antibiotics, even those without visible symptoms, the reservoir of infection can be significantly reduced. Technological advancements such as rapid diagnostic tests and improved surveillance systems are playing a crucial role in the fight against yaws. These innovations enable faster diagnosis, more targeted interventions, and better tracking of progress towards eradication. Eradicating yaws is not just a public health triumph, it's a testament to human ingenuity, collaboration, and the unwavering belief in a healthier future for all. By working together, we can consign this ancient scourge to the history books. Section 10. Addressing Misconceptions and Stigma. Despite its treatable nature, yaws often carries a stigma, particularly in affected communities. This stigma can prevent individuals from seeking timely medical attention, leading to delayed diagnosis and treatment. It's crucial to address misconceptions and dispel myths surrounding yaws to encourage early help-seeking behavior. One common misconception is that yaws is a curse or a punishment for wrongdoing. It's essential to emphasize that yaws is a bacterial infection, not a reflection of one's character or actions. Educating communities about the true nature of the disease can help reduce shame and encourage open dialogue. Another misconception is that yaws is only a cosmetic concern. While skin lesions are a prominent feature of yaws, the disease can have serious long-term consequences if left untreated, including bone deformities, disabilities, and social isolation. By promoting accurate information and addressing stigma, we can create an environment where individuals feel empowered to seek medical attention without fear of judgment or discrimination. Section 11. Conclusion, a call to action for a yaws-free world. Yaws is a disease of poverty, neglect, and inequity. It thrives in communities lacking access to basic health care, sanitation, and education. Eradicating yaws is not just about medical interventions, it's about addressing the root causes of health disparities and creating a more just and equitable world for all. We have the tools, knowledge, and resources to eliminate yaws from the face of the earth. What we need now is unwavering commitment, sustained investment, and collaborative action from governments, international organizations, and communities. Let us rise to the challenge and work together to create a world where every child can grow up free from the threat of yaws and its devastating consequences. Together, we can make yaws a disease of the past and build a healthier, brighter future for generations to come. The time for action is now.